Hello everyone. Welcome to our course Introduction to Basics in Veterinary Diagnostic Imaging. I am Dr. Dayamondi Matthew, Assistant Professor in the Department of Veterinary Surgery and Radiology, Faculty of Veterinary and Animal Sciences, Institute of Agricultural Sciences, Banaras Hindu University. In this session, we will be learning about the general principles of radiation safety. We'll just start with the introduction part of this. Before going deep into the radiation safety, we are supposed to know certain terminologies. The first one is the electron volt. It is the energy gained by one electron as it is accelerated through a potential difference of 1 volt. The ionization occurs when an electron is ejected from the atom. The X-rays with energy of only 15 electron volt can produce ionization of atoms. When X-rays strike a person, they can result in ionization in DNA, which can lead to mutations, abortion of fetal abnormalities, susceptibility to diseases, and shortened lifespan, carcinogenesis, and cataracts. These are the reasons why it is important to minimize the exposure of personnel working in a radiation environment. The same effects exist on patients undergoing medical imaging procedures, but the risk of radiation from isolated imaging procedures is offset by diagnostic value of the procedure. The radiation workers are exposed to continuous low-level radiation exposure, which increases the chance of damage. And the radiation damage to DNA can be amplified biologically because the DNA controls the cellular processes that extend into subsequent generations of daughter cells. And this makes these X-rays to be one of the most dangerous thing in this world. The goal in diagnostic radiology is to obtain maximum diagnostic information with minimal radiation exposure of the patient, radiology personnel, and the general public. And this is achievable if guidelines for safe practice are followed and the technology available to reduce the exposure to personnel is used. The radiation units. The radiation exposure and the radiation absorption are not the same. Certain tissues, they absorb more radiation effectively than others, and the biologic effect of the same absorbed dose can also be different. There are two units of measurement that are used in radiation. One is the CGS system, which is otherwise called as the centimeter gram second system, and the second one is called as the SI system, the SI unit system, which is also called as the International System of Units. Exposure dose. The radiation exposure is based on the amount of ionization in air that the radiation produces and is quantified by the amount of electrical charge resulting from the ionization of air produced by the radiation flux. And the unit of radiation dose is Rengen, and 1 Rengen is equal to 2.58 C per kilogram of air. The next is the absorbed dose. The absorbed dose is the efficiency of the X-ray absorption in different materials, which can vary widely. The unit of the absorbed dose is gray. In CGS system, this is defined to be a rad, and where 1 gray is equal to 100 rad. Where 1 gray is the amount of radiation that leads to absorption of 1 joule per kilogram of tissues. The soft tissue, such as muscle, which get exposed to 1 rad, amount to an absorbed dose of approximately 0.9 centigrade. And the bone is a more efficient absorber of X-rays than soft tissue, and exposure to bone of 1 ring R results in a bone absorbed dose of more than 0.9 centigrade. The next is the equivalent biologic dose. The dose equivalent, or the equivalent biologic dose, is the product of the absorbed dose in gray and the weighting factor, and the unit is called as the sievert. Previously, the unit was rem, which means the radiation equivalent in man. Radiation safety. Principles of radiation safety are based on establishment of guidelines to prevent undesirable and unnecessary exposure of radiation workers and the general public to ionizing radiation. The low-level radiation exposure is permissible and will not lead to significant abnormalities or diseases. When we talk about the adverse effects of radiation, the adverse effects can be classified into 2 effects. The first one is called as the deterministic effect, and the second one is called as the stochastic effect. The deterministic effect, this has got a threshold, which means that there won't be any effect until it crosses that particular threshold. No effect if it is below the threshold, and the effect is related to the dose. One such example for a deterministic effect is radiation-induced cataracts, which means that the cataract happens only when the threshold is above the threshold. The second one is the stochastic effect. This has got no dose threshold, and the severity of the effect is independent of dose, and this includes the radiation-induced cancer. The next is the maximum permissible dose. It is the maximum amount of absorbed radiation that can be delivered to an individual as a whole body dose or a dose to a specific organ and still be considered safe. This doesn't mean that if a person is getting exposed to within the limit of MPD, the person would be safe. It just means that it can be under the control. It doesn't provide you any specific safety that we talk about. The recommended annual radiation dose to adult radiation workers is a maximum of 50 mSv per year, while the monthly exposure limit for the embryo of fetus should not exceed 0.5 mSv. And the general public, it shall not exceed 1 mSv per year. The thing that we have to understand here is that a person in adult who is an adult radiation worker, he can have a higher MPD, and while a fetus, which is a developing one, it shall not have an MPD of more than 0.5 mSv. That is very much dangerous for these embryo, and for the general public, it shall never be greater than 1 mSv per year. Coming to the practical considerations, the personnels working in the radiology section, they must be aware of the risks of radiation. They should be well trained in positioning, machine operation, and image processing so that the repeat studies are minimized. The use and care of radiation protection equipment such as protective aprons and gloves, and in the concepts of ALARA principle shall be kept in mind. What do you mean by this ALARA principle? It is nothing but the as low as reasonably achievable principle. This should always be kept in mind while we are there as a radiologist to take a radiograph. we shall always keep the exposure settings as minimum as possible, which can give us a very good radiographic image. This maintain the exposures to ionizing radiation as far below the dose limits as practical, consistent with the purpose for which the licensed activity is undertaken. And the major variables used in adhering to LRA are the distance, time, and shielding. But when we talk about this LRA principle, before that, I would always like to say that we are supposed to make understand the technician and the people whoever are there inside the radiology section about the safety concerns about the radiological radiology. They should be well aware about the risks, so that they themselves will take a stand to protect from these harmful radiations. Positioning, which is very essential to be kept in mind while taking radiographs. If we have to take a radiograph, it has to be the area of interest shall always be kept at the center of the radiograph, and the projection shall be taken. And we are not supposed to have any other hindrances while taking a radiograph. Distance. It is one of the most effective ways of reducing dose. Doubling the distance reduces exposure by a factor of 4. This has to be kept in mind always. When we are going to have a position, if we are standing inside the radiology section during a radiological procedure, and if we can stand twice the distance where we were standing before, that can reduce the exposure factor by 4. That's very important to be known, so that we can keep ourselves safe. The next is the holding of the cassettes by hand shall be discouraged as much as possible. Always plan to have a cassette holder to hold the cassette if we have to hold it, but avoid direct handling of the cassettes using the hands. The portable X-ray machines should be held in hand only after proper shielding. There are certain shields available for shielding ourselves, like aprons, thyroid shields, the gonadal shields. So we shall always be attired with the required shields while we are going to handle a portable X-ray machines. Even certain X-ray machines will be having a lead glass kept very close or around the X-ray tube of these portable machines. Next is holding of companion animals is permissible, but body parts in the vicinity of the primary beam should be strictly avoided, regardless of whether protective barriers are used. What happens usually is when we are there with the animal inside the radiology section to take a radiograph, we will be forced to have the patient honor along with the animal. We will be forced to have the technicians to be there with the animal in restraining it. And while restraining and positioning these animals, the personals in and around, it can be either the owner or the technician, they will be having their body parts within the limits of the primary beam, which is very dangerous. And we shall keep all those, keep ourselves out of these primary beams as much as possible. Next is to use chemical restraint, tape, sandbags for restrainings that shall be encouraged, which can reduce the presence of human beings, the personals, in and around the patient. The next is time. The time is directly related to the number of views or remake views needed. The time can be minimized by using sedation or anesthesia for uncooperative patients or for complicated examinations such as spine or skull studies. Familiarity of the personnel with equipment and its operations is very much essential to reduce the time, and the rotation of the technical staff through the radiology service will also dilute any exposure or over a larger pool, leading to reduction in individual exposure levels. This is very essential to keep the radiation exposure minimum as possible. The time that we are going to use, the time to be there in front of the radiology, the radiation shall be minimized as much as possible. If I have to take a radiograph of an uncooperative animal, if I have to take a radiograph of an animal which we have to place it in an awkward position, especially a ventrodorsal positioning of an animal for a hip radiography. That's an awkward position for the patient. The animal will not be cooperating with us to take the radiograph. During that situation, we may have to be present with the animal throughout the radiological procedure. So what happens is, when we have to be there, the personnel are going to get exposed unnecessarily. One thing. Second, with respect to the time, I'll have to be there for a longer period, restraining the animal to make sure that the radiographs are going to come good. So the time is going to be a major concern here while we are going to take a radiograph. Next is shielding. The structural shielding shall be used to protect personnel and the general public. One thing that we have to think always is, if we have a radiology section, we shall always have a thin lining of lead attached onto the wall, so that the X-ray radiations will not cross the wall. One thing. Second, the walls will not reflect back the radiations which it is going to hit, which it is going to get hit from the scattering. The personal shielding for radiation personnels is the lead impregnated aprons, gloves, thyroid shields, and eyeglasses. The aprons, usually they have a thickness, the lead thickness it usually has is a 0.5 millimeters, and that gives protection against the scattered radiation alone. Keep that in mind. Apron is going to just give a protection against the scattered radiation alone, which means that do not take it for granted. Once you wear an apron and you go underneath primary beam and get yourself exposed, that's very dangerous. These aprons, which has got just 0.5 millimeters thickness of lead, that will only protect us from the scattered radiation. The next personal shielding is the goggles. It protects the lens, and usually the lead lining is somewhere is having a thickness of 0.25 millimeters of lead. The improper care of lead aprons and gloves, it may result in cracking or separation of the protective layering that reduces their effectiveness. They should be kept on racks when not in use, and this will decrease the risk of creasing and folding that lead to cracking or separation of the protective lead layering. And it should be inspected visually on annual basis and radiographically if physically damaged. So we all know that we have to wear lead aprons while we are inside the radiology section, but Most of us doesn't know how to maintain these lead aprons and the lead shielding devices or lead shielding equipment. These lead shielding aprons shall never be folded. Shall never be folded. If you keep it folded, when it becomes in due course, it will get a crack, and which will be a place for the radiation to enter into the body. Though we say that, even when we say that these aprons are just going to protect us from the scattered radiation alone, and when we are going to be there with the patient with a cracked lead, which we may not be in a position to identify with our naked eye, because the clothing which is present over the lead may be hiding this cracks which is present inside, and that usage of those lead aprons may cause may lead to the entry of radiation, and it may affect the person, whoever is wearing it. Next is personal monitoring. It is used to check the adequacy of radiation safety program. It discloses the improper radiation protection practices and detect potentially serious radiation exposure situations. A radiation dosimetry badge, also called as a film badge, it is the most commonly used personal monitoring device. And it consists of a plastic holder measuring somewhere about 2 to 3 centimeters on a side, which has got a clip allowing it to be secured to the clothing. Previously, it was having films placed inside these plastic holders, and later the degree of blackness was extrapolated to see the amount of exposure. But at this moment, we have a radiation sensitive aluminum oxide or lithium fluoride crystals. And these badges, they trap electrons which can be quantified and related to the amount of exposure. These are more accurate than film badges. And these radiation badges are only to be worn in the workplace and not during a medical exposure. And one badge shall be exclusively used by one radiation worker, and it should be worn on the upper or the lower torso. When a protective apron is worn, the radiation badge may be worn outside the apron for monitoring the radiation environment. And if you want to check the exposure to the body, a second badge may also be worn inside the apron. The radiation badges should not be shared between employees, and the film badges of another person should never be tampered. There are certain basic radiation safety rules in the diagnostic radiology, and if we maintain all these basic rules, that will be all sufficient enough to protect ourselves from the radiation injuries. The only person necessary to complete the procedure should be in the X-ray room at the time of exposure. Minimize the people inside the radiation room. The persons younger than 18 years and pregnant women, they must not be in the X-ray room. The assistants shall be placed on a rotational basis, and the restraining devices and chemical restraining techniques may be employed to reduce the number of people there, to reduce the number of radiographic projections, and to reduce the time of exposure. No part of personnels should be there in the primary beam. This has to be kept always in mind, because while we hold the animal, try to control the animal, restrain the animal, or position the animal on the table for radiography, we will be forced to have to have some part of our body under the primary beam. That shall never happen. That has got severe ill effect. Usage of the protectives like thyroid shields, the protective aprons, gloves, goggles, etc. Collimation shall also be done properly to reduce the scatter radiation. This is going to reduce the excessively deviated X-rays, and it is going to have more parallel rays pass out of this X-ray tube. Always make sure that a radiation badge is worn whenever you are there inside the radiology section when a procedure is being done to monitor the exposure. Next is to have a radiation exposure, to have a good planning before a radiation exposure, which means that if we have to take an radiograph of an area of an animal, make sure that make a good plan about how you are going to restrain the animal, how you are going to what are the different settings that you are going to have for that particular radiograph, how many people shall be there inside the radiology section, and the animal and the radiograph should be taken in the shortest time. A very good planning is highly essential to is highly essential before a radiographic exposure is planned. So here ends today's session. Let's meet in the next session. Thank you.